Night Health continues. I'm Mark Allen. We're going to go up to the Seattle area and visit with somebody I think is going to be coming back to Late Night Health, Dr. Alan Snow. He has a PhD in pathology. He's a world-renowned expert in brain aging, memory loss, Alzheimer's disease, Parkinson's, and more. Dr. Snow, welcome to Late Night Health.
Thank you very much. Pleasure to be
now,
here.
One of the things that as a baby boomer, we tend to be afraid of waking up and not knowing who we are at all, not having memories. And I think most memory loss is not overnight like that. It's gradual. But is it really something that baby boomers are afraid of, more so than even making Medicare payments?
Well, I think it's becoming increasingly clear that as you age, you got to be worried about memory loss. Studies show, and this has been published for many years, that starting in your 20s now, beta amyloid plaques, which look like meatballs in the brain, start accumulating. And then shortly after, you get tangles, which are like dried up spaghetti inside neurons, which also kill cells in the brain. So plaques, which are outside neurons, start accumulating out of nowhere. And then you get tangles. And then if you have like number 3, which is neural inflammation, then basically you have Alzheimer's disease. So I think that people should be worried about their brain as they age, but there is a lot of things that they've discovered in the memory loss field during the last 5 years, actually, lifestyle changes that can actually help you adapt to the aging brain.
The other day I spoke with the executive director and president of the Alzheimer's Foundation, and there are brain exercises that we can do. At the very least, it would seem to me that we're doing something positive. Is there more that the average person can do to protect their brain, to protect themselves, to protect their identity? Talk about identity theft.
Yeah.
Right.
I think there is. My partner and I, Rudy Tanzi out of Harvard University, he's the head of genetics at Massachusetts General Hospital and also the scientific chairman of the Cure Alzheimer's Fund and the concussion coach on the field for the New England Patriots. Rudy and I started a company called Cognitive Clarity Incorporated a few years ago. We've developed a dietary supplement that we could talk about later. But what Rudy actually came up with is the SHIELD program, SHIELD, in which you could do lifestyle changes that could help your brain, starting today. And if you want, I could go through what SHIELD stands
Yeah,
for.
please.
So the S in SHIELD has to do with sleep, and research has found that during REM sleep, when you have really good sleep, you're actually clearing your brain out of beta amyloid plaques. And people who don't have very good sleep show that it's less able to clean it out at night. So sleeping at least 8 hours is the S in SHIELD. H is for handling stress. So stress can also sort of muck up your brain, and if you're able to do meditation or things that you can handle stress better, that helps. I is for interacting with others. So they found that people who live alone, and my mother has late-stage Alzheimer's disease, and I deal with it every day. I remember after my father died, she lived alone for like 12 years, and then she started getting the signs of Alzheimer's. So interaction with others is very important. The E in SHIELD stands for exercise. So they have found that when you exercise, you actually help your brain, which has been interesting and amazing data coming off of that. exercise also increases BDNF, brain-derived nerve factor, which seems to be, it's like they would love to bottle that so you could just take it instead of exercising. You could take a pill for that. The L in SHIELD stands for learn new things. So if you learn a new hobby, and it's something like that you haven't done before, like playing a new instrument or learning a new card game, that's actually even more beneficial for learning new things. And then the D in SHIELD stands for diet, and they found the Mediterranean diet, rich in nuts and vegetables and fish, is very good for your brain. So this acronym was developed by Dr. Rudy Tanzi, and a lot of people are using the SHIELD program. You know, when I remember 30 years ago that they used to tell medical students, and they published that adult neurons don't divide. I mean, that was like the dogma, that once you have neurons, after a certain age, you're not going to get any more. So that was completely wrong. They found that actually the brain can adapt and there's plasticity, so that as you learn new things, your brain you could actually see the change in shape of the brain. The folds are increasing, more synapses. And so the brain is actually very adaptable and able to mold into something new as you're going through all these processes.
You mentioned that you've developed a supplement that is designed to help with brain health and to support brain health. Can you tell us about that?
Yes. I've been working on drug development for 30 years, coming out of University of Washington, where I was a research associate professor of pathology, and I was part of the University of Washington Alzheimer's Disease Research Center for 10 years. As we were looking at basically drugs to inhibit the formation and accumulation of brain plaques and tangles, we actually developed some screening assays, and we started looking at natural products. And we identified about 20 years ago that a plant called Uncaria tomatosa, or cat's claw, coming out of the Amazon rainforest, which is a woody vine that grows 200 feet. And the Peruvian tribes used to take the bark of the bottom of the tree, so it's cat's claw bark powder. And they took the bark bundles and they put it, they sold it in the marketplace, and then people made a tea out of it. So they boiled the bark to make a tea, and then Keplinger in the late 80s found that it was very good for the immune system. What we discovered is that it actually gets into the brain in 2 minutes. We did a lot of studies with Tulane University blood-brain barrier laboratory, Abba Caston's laboratory. And then we also found that there are we discovered new polyphenols in cat's claw that interact with plaques and tangles and basically cause them to dissolve and be reduced and inhibit their formation. So
why isn't, I'm sorry, I didn't mean to interrupt. Well, actually, I do. Then why isn't every American over the age of 40 taking this?
Well, I think it has to do just people finding out about it. We actually published a big paper in Nature Scientific Reports. It's a 108-page paper that came out in February 2019. And it has all the data, all the research that we did for over 10 years. We basically kept it secret because for a while, for over like 10 years, and the reason was because we were just writing patents on it. I was in a private company, and basically the company decided, not to publish it, but to keep it secret. When I formed Cognitive Clarity, I said, and I watched my mother go into late-stage Alzheimer's, and I said, we need to get this out because that's why I formed the company. I wanted to make this dietary supplement as fast as I can to get it out to the public. And so right now we have a few products on the market. The main product is called Percepta, like perception, and you could buy it on Amazon.com and also on our website, www.perceptabrain.com. So Percepta consists of 2 ingredients. One is cat's claw from the Amazon rainforest. We found the best cat's claw. that actually targets brain plaques and tangles. And then there's a oolong tea extract. We did some research on different types of tea, and we found that oolong tea is actually much more beneficial for brain plaques and tangles than black tea or green tea, and it has to do with the fermentation of the plant Camellia sinensis. So green tea is unfermented, unoxidized. Oolong tea is partially fermented or partially oxidized, and black tea is fully fermented or fully oxidized. So even though it comes out of the same plant, we discovered that partially fermented oolong tea actually has the most beneficial polyphenols in there that really target and reduce plaques and tangles. So Percepta consists of those two ingredients, the cat's claw, which we call PTI 00703 cat's claw, and then this oolong tea extract, and that makes up the product called Percepta.
And Percepta is spelled, let's just get the spelling right so everybody knows. P-R-E-C-E-P-T-A?
No, P-E-R-C-E-P-T-A. Like perception, Percepta.
P-E-R-C-E-P-T-A. All right.
T-A.
I will edit that out. I edit my stuff, my mistakes. I don't edit out your mistakes. Let's talk about your background a little bit further. You've been studying this for, you said, 30 years. You must have started at 14 because I've seen your photograph. Why did you go into brain health as a specialty, as a pathologist?
Well, actually, when I was younger, I wanted to be a professional tennis player. I was ranked I was on the Canadian tennis team at age 18, and I actually got a scholarship to Bowling Green State University in Ohio. So in the time of Connors and Borg and McEnroe, I was like watching Wimbledon 8 o'clock in the morning, and I was like completely obsessed with tennis. I would play like 6 hours a day. So anyways, when I went to Bowling Green, I played for the tennis team there, but I also got into science. I ended up getting a Bachelor of Science in Biology and Chemistry. And then I ended up going back to Canada to the University of Western Ontario. I did a master's degree in anatomy. I was doing colon cancer research. And then I went over to Queen's University, which is in Kingston, Ontario, Canada. I was born in Toronto, so I have a lot of family there. Originally Canadian. But at University of Washington is where, when I did my PhD with Dr. Robert Kieselewski at Queen's, that's where I got into Alzheimer's disease and what they called amyloid disorders. And I started working with him. In the late 80s, when I came to University of Washington, I discovered that there was a carbohydrate in the brain called heparan sulfate proteoglycans that accumulate in the lesions of Alzheimer's. And I started getting a lot of funding from the National Institute of Aging, National Institute of Health, the Alzheimer's Association, and I started my own lab at University of Washington and did a lot of research there. So I've been looking at this for a long time.
Will there be a cure for Alzheimer's? Or
I would say that there will be improved treatment. I say that it's multifactorial, that Alzheimer's can be caused by a few different things that will all come together sort of in the same disease. As you know, probably familial Alzheimer's that runs in families, and when I say it runs in families, that's usually 2 or more consecutive generations, like the grandfather had it, then the mother had it. Those are usually due to mutations in a gene like beta-amyloid precursor protein or presenilin. And then once you have it, you can see it in the family tree. And they get it earlier, too, in their 40s and 50s rather than like 60s, 70s, 80s. 95% of cases are sporadic, so nobody knows why or how it's caused, but you can see in the brain what's going on. So you do see the plaques and tangles. Anybody coming to autopsy from Alzheimer's. And now, in the last 5 or 6 years, PET imaging now allows doctors to see the plaques in live patients and now tangles as well. So I know people that if they're really worried, they go to UCLA and they can have their brain scanned. They inject you with a dye that basically goes into your brain and then binds the plaques or tangles, and then it lights it up and they could see it. So they know your plaque load, and that helps with the diagnosis as well, and running clinical trials now that are better than they were.
And what about, just aging? Forgetting a word here or there. Is that normal? Is that a natural thing? And do millennials drop a word here and there as well?
I think dropping a word here and there is fine. That's just part of, brain aging, and you're losing neurons, like I said, by the accumulation of plaques and tangles. So walking into a room, forgetting your keys or why you did this, I don't think you should be too alarmed at that. It's, and I remember this happened to somebody, a friend of my mother's. He couldn't remember how to get back home, so he couldn't remember directions of where he lived. And obviously that's a bad sign, and he went on to develop Alzheimer's disease quite quickly thereafter. So, early forgetfulness, I wouldn't say you should be too alarmed at that. And like I said, if you did things according to the SHIELD program, you would see an improvement in various areas.
All right, now I'm going to ask you a question as Alan and not as Dr. Snow. How many hours of sleep did you get last night?
No, I'm not. I'm not a good. I don't sleep very well. Period. And so I already know there's a risk factor there. My brain is always racing, and then I do not sleep 8 hours a night. I know that. So I try and boost it up on the other side by exercising 5 to 6 days a week and doing other things that I can do. But sleep is not my forte, I would say.
It's not mine either. And it's 5.5 or 6 hours, and I'm good. What about right?
Yeah, right.
And I'm lucky if I get that. This is Late Night Health. Our guest on the special edition of Late Night Health is Dr. Alan Snow, and he's won some very prestigious awards from the Michael J. Fox Foundation for Parkinson's disease. He's been awarded 18 National Institute of Health, NIH grant awards, and many, many more. And he's helped to develop, did develop a product called Precepta. And I'm really excited about it. I'm going to get some, and I will report back to see if I feel anything. That's an important part. An important point. If you take Precepta, can you feel the difference? Can you know the difference? Or is it just something that is a preventative, shall we say?
You can actually feel the difference. And if you actually go to PerceptaBrain.com and press the testimonials button, you'll see that within 2 to 3 weeks, most people are reporting an improvement in their focus, memory, brain fog, concentration. And what we believe is going on is that it actually gets into the brain and can reduce plaques and tangles, which basically clears out the muck that's accumulating in your brain. And if you could reduce that or clear it out more, then you start to be able to concentrate, much better focus, and people have been reporting that. Now, people have more advanced memory problems. We recommend taking it for 90 days, for 3 months.
And then being tested before and after, maybe?
Well, we intend to do a double-blind, placebo-controlled study in 200 patients. Hopefully, in 2020, we should finish it. So we're actually we're setting up to do that study to see a couple of things. One is what's its effects on memory, concentration, focus, and executive function, which is processing speed. and we want to see how fast it works, because we believe it works in days to weeks. And so we're going to be doing a time course very early on, within hours to days to a month, 3 months, and 6 months. It'll be a 6-month study.
Dr. Snow, thank you very much for joining us here on Late Night Health. Let me give the website again. You can either go to Amazon.com or Percepta.brain.com. Percepta, P-E-R-C-E-P-T-A, brain.com. And the name of the product is Percepta, correct?
Yeah.
Yeah.
And we also have a product called Percepta Sport. It's our second product, which is NSF certified for sport. So this is actually for professional athletes and teams, and it has no banned substances. So it's been third-party tested for heavy metals, pesticides, all that kind of stuff. We do that in all our products. And one of the things I think that makes us unusual and should be in the dietary supplement field is that we test our ingredients for plaque and tangle activity, and then we test the Percepta capsules that come off the production line, and each lot is tested again for activity. We actually have research labs at Cognitive Clarity Incorporated. So just like I started research labs at University of Washington with about 20 PhDs and technicians, then at my first private company that I had for 15 years when I was developing small molecule drugs for Alzheimer's and Parkinson's, we started big labs there as well. And then now at Cognitive Clarity Incorporated, I have a few research technicians and PhDs that I had with me for 15 years, and they're doing all the testing and screening that we're doing right now with Percepta in comparison to other brain supplements.
What made you decide to develop a supplement rather than something for big pharma?
Yeah. So I went through the big pharma route. So it just takes too long, and it's too much money. So to do a phase 2 trial in humans, I mean, you're talking about $50 to $100 million. And then you get into phase 3, and you're talking over $250 million. So it does take $1 billion to make an FDA-approved drug. The reason I wanted to get this out as fast as I can is I saw the benefit with a natural plant extract, and I thought that, we need to get this out because it could help people today. And so that's why I decided to go through the dietary supplement route. And again, this is not intended to treat a disease. It is, something that helps brain health in general. And so that it's just going this route is much better, much faster.
Thank you very much for your time. Hold on a second as I wrap up this segment of the show. Dr. Alan Snow has been our guest. We've been talking about brain health. You can visit him at perceptabrain.com, perceptabrain.com. I'm Mark Allen. Late Night Health continues.